Good afternoon. Welcome to the Talk on Health. The Talk on Health is a monthly chat to address the health concerns of the community with an emphasis on the concerns of underserved women. Thank you so much for joining us today. This talk is sponsored by the Lower Cape Fear YWCA and the Wilmington chapter of Delta Sigma Theta Incorporated. I am Dr. Lakeisha Jarrett, and I am a family medicine physician employed by Wilmington Health, and I will be your host today. Thank you again for joining us. We will begin with a land acknowledgement. The YWCA of Lower Cape Fear serves the people located within the Lower Cape Fear region. This land once thrived with life from indigenous people, known today as the Cape Fear Indians and the Waccamaw Siouan Indian people, living in established settlements along the Cape Fear River and Lake Waccamaw, along with many other established sites in the region. We need to protect and honor the history of these places. Indigenous people are not relics of the past. They are still here, continuing to demonstrate their talents and gifts amidst a backdrop of ongoing colonialism and oppression. They are worth celebrating. We hope our land acknowledgement statement will inspire others to stand with us in solidarity with Native nations. Today's talk is titled, Stop the Superwoman Stress. As with most of our talks, it is an appropriate time to have that because as the world opens back up, mothers definitely will have more responsibility taking children to different places. The one thing about COVID that I appreciated as a mother was that I got to stay home and my children got to Zoom, so we didn't have to drive a lot to get to different places. So as the world opens back up, we hope to be able to give you some strategies to deal with the stress that is to come. Our wonderful panelists today are Mrs. Fay Jacobs, Dr. Janie Canty Mitchell, and Dr. Shelly Brown Cooper. I will allow them to introduce themselves, beginning with Ms. Fay Jacobs.
Hello, my name is Fay Jacobs. Thank you so much for inviting me to come in and talk about caregiving and the sandwich generation. My working career has been with working with senior citizens. I was very lucky when graduating from college that all of my career has been working with older adults. For 28 years, I was the senior center Independent Life Services Director here in New Hanover County. I retired in 2012 for about 3 years, and then I was fortunate enough to get another job working with the geriatric team that works with training staff members and volunteers on how to deal with dementia clients, how the approach, communication skills, the types of dementia. And I again thank you for allowing me to come in and talk about the sandwich generation, care and caregiving and its impact on women.
Thank you, Fay.
Mhm.
Next, we have Dr. Janie Canty Mitchell, and I will allow her to introduce herself and tell us about what she does.
Hello, again, I'm Janie Canty Mitchell. I am a registered nurse by profession. I have worked in different capacities in those 45 years and still working in my retirement in those areas. My special interest in nursing has been in public health, which looks at all of those things in our society, our social environment within us that impacts on our health and physical well-being. I focus a lot on adolescent stressors and things that cause them stress and how they cope. Also with women and how they cope with the different stresses in their lives. I worked in academia for 26 years, and I've taught students at all levels through the doctorate. And I have always had a community academic partnerships to help to deliver programs for the community. For example, when I was at UNC Wilmington, I was directing youth health summits for 5 years while I was there. And it was partially funded by a grant from the Robert Wood Johnson Foundation Executive Nurse Fellows Program. So I've had lots of awards, lots of things in nursing, but my real focus right now is on empowering women and helping women to cope with the stresses that they have, and most of all, to engage in self-care.
Thank you very much. I look forward to hearing more about that. Next, we have Dr. Shelly Brown Cooper. Could you please introduce yourself?
Thank you so much for the opportunity to speak today. I'm speaking to you from Kansas City, the Midwest. And so I'm happy to bring greetings on behalf of Midwestern states. A little bit about my history. My expertise is in the field of telehealth. My company, Diversity Telehealth, was started about 6 or 7 years ago when I completed my doctoral studies in telehealth adoption and implementation. So prior to that, I worked 10 years in finance and banking and telecommunications, and then a speedy 25 years of education experience that just flew by. It was a joy, working with all grade levels, including those on the master's program in higher ed. With Diversity Telehealth, my focus is to bring telehealth and access to care to underserved populations. So I was more than ecstatic to accept the invitation to speak with your audience today. The focus of what I'm going to talk about is bringing telehealth to women and also allowing different fields of technology and modalities to connect women to behavioral health services. So my expertise of late has been designing telehealth solutions where behavioral health is the objective, and working with women now, especially with all the stressors that are going on in the pandemic and the social environment, economic as well. Being able to have access to behavioral health, therapists, psychiatrists, psychologists, and the like is very, very important. So using those technological tools to make that available to women will be the focus of my discussion.
Thank you very much. Well, we are just going to jump right in now with some questions that we have. The first question is, what is caregiver stress?
Caregiver stress, I think I'll take that if it's okay with Dr. Mitchell.
Oh, yes, I was waiting on you.
Okay, caregiver stress. I want to talk about the stress that you have in reference to taking care of older adults, taking care of your children. We have become a society where women are the basic caregivers, whether we like it or not. That's our role. Unfortunately, we have taken that role from childhood to adulthood. 65% of caregivers are women. Men do take care of older adults, but most of the time it's women. Women who care for family members are 2.5 times more likely to live in poverty. Caregiver impacts wages, retirement, promotions, and ability to remain employed. What happens, some of the stresses may be headaches, maybe anxiety, maybe depression, maybe frustration. You have so much going on that you don't know how to cope effectively with what's going on. We now live in a society where parents, and especially we'll say middle age, I'm talking about the sandwich generation. These are middle-aged people, 40 to 59. They are taking care of older adults, their parents. Women usually are taking care of their spouse's parents too. Then they are taking care of a new term is called club sandwich generation. And that is where the woman is taking care of her family, teenage children, or older children. Then they are taking care of their children's children. And so that may be a little financial support, emotional support. A typical day may be you're working, mom calls and she wants to go to the grocery store. You may take your lunchtime instead of relaxing, taking time to get yourself together. You may have to go to the grocery store. You may have to go to the pharmacy. She may having problems with her light bill. You have to go over there and support her. Now you're still working. Okay, so you got the stresses from your job because you got to be back by 1 o'clock. You got the stress of getting to wherever mom has asked you to go. You got the traffic going on. You got what you were doing at work. You got what mom or your dad is asking you to do. Then you have your adult children asking you to do something. All of that is stressors. That's a most time a typical caregiver's day.
And then you also said that sometimes they even have their grandchildren at the house to take care of. So I've also heard a lot of people talking about parents or grandparents teaching their grandchildren on Zoom because the parents will have to work. So that is also another big stressor, I know, for grandparents sometimes.
Right. And a good thing about that though, it is a learning tool on both ends. A lot of older adults are not into the Zoom. I kind of laugh myself when a 5-year-old can take the phone and show me what to do. And I say, somehow they've been implanted doing birth because they can somehow automatically know how to do this while I am struggling. But you can look at it as a positive because you're bonding with your grandchildren. However, it is a stressor because even the math that they are doing now, the way we learn how to do math is totally different the way that they do math. And so you're learning how to compromise and you're learning new things yourself.
Right. Would you like to speak more on caregiver stress, Dr. Canty Mitchell?
Well, I think she covered it well. Just a few points I wanted to make on stress in general. When we have that accumulated stress, I'm looking at more of the physical effects on the body. It's in like a fight or flight. And over time with chronic stress, you have this continuous amount of cortisol build up in your body and all kinds of physical effects on your body. And stress is related physiologically to increases in high blood pressure, weight gain, obesity, maternal health outcomes, as well as cardiac disorders. So your body is in this fight or flight reaction all the time. And so with especially African-American women, we've had this kind of stress build up over time. So we look at the factors related to racism and other things that are happening in our society, financial difficulties, as well as taking care of our children, our families. We're very involved in the community, our churches, and all these other areas. It puts additional stresses on us. Now, I also want to just focus a little bit on, the chronic stress is what I really focus on. That's really important for us to look at. It's not just one thing that happens. It's not just taking care of the children or the family or whatever. It's all these accumulated things that have happened over the years, things with our work, for example. And of course, these different manifestations of stress, the environment and all this stuff, keeps us hypervigilant. And so when we get into that point, there are some mental health issues that fall out from that as well. And I think Fay Jacobs mentioned that as well on your body. You may be getting into behavioral kinds of issues. You may have loud earth outbursts. The angry Black women, sometimes said a lot. And a lot of that is built up on the stresses that women face. I remember when, growing up, my mother was, she was only like 16 when she married my father, who was 21. And within 8.5 years, she had 6 kids. And then in a couple of years after that, she was divorced. And then she had low wages. She didn't have a high school diploma. And so all of these things, I'm looking at it from that perspective of this woman, and more women are like that in our society. So what she did, and I think and we'll get into some strategies to how to support women with these multiple factors. We have the behavioral approaches Dr. Fay Jacobs is talking about, and Dr. Shelly Cooper will also talk about the behavioral issues. But what about the other supportive mechanisms within our environment? You'll see that most women, a lot of Black women especially, go to church. So church is sometimes that supportive mechanism for women to release and to get those supportive networks going. So I think the physiological impact of the large stressors on our body, and it's so much evidence now is like the weight gain, cardiovascular, heart disease, all these things are related to stress.
I agree. That is such a good point. And as a family medicine physician, I definitely see that every day. I would even go one step further and say even things like diabetes, just because if you're not focused on taking care of your health, or you have those stressors where you're taking care of someone else all the time, then you don't have time to think about how you're going to eat, or even taking your medicine, sometimes forgetting to take your medication.
Or the financial impact of even getting the insulin.
Right. Or the financial impact of even getting the insulin. Yeah. And even sometimes I feel like pain is also related to a lot of the depression and anxiety. Mm-hmm. So there are just so many manifestations of stress on your health.
And we have bought into this Superwoman syndrome, especially Black women, that we can do all things. And
all that Black girl magic.
Oh, yeah, and we do have it. The problem is we are maintaining healthy behavior is so important. We have to get into that. It is not selfish to think, wait a minute, somebody else can do this. But we get into this, and sometimes I say this bedside death promise that we made Mama, that we were going to take care of Dad. And at the time, we meant it. And your heart still wants to do it, but there are some limits that you have to now think about it. You have to take the steps to protect yourself so that you can help other people. It is not selfish. If it's something as simple as taking a deep breath, something as simple as eating the right food, exercising. If you just have to say, okay, I'm going to the bathroom now, I'm closing the door. Don't call my name, please. Just give me 5 minutes. You need to take this. It's okay to do this. But again, we have brought into this, I can do it all. And now that we are working at home, you would think that, I hear this a lot, that, oh, this is what I really want to do. But working at home, you don't have time to take a break. You're on time all the time. So therefore, all of these stresses, fight, flight, or fright, those coping mechanisms are going to come to play, because you can't do it all. But don't blame yourself because you can. You know,
it is often difficult when you work from home to separate work from home life. Because when I started medicine, I would say when I turn into my driveway, I'm done with work. I need to be present for my family. But when I'm not turning into my driveway, I'm just like, turning the computer off and closing it. It's a little bit more difficult to separate that.
I want to build on a little bit of what Fay Jacobs said about stress. We all have things that cause stressors, but the accumulative stressors put demands upon us. And the big thing is our perception of those stressors that causes stress, and also whether we have the resources we need to help deal with it. And so that's a big factor. If you have these things happening and you have lots of resources to support you in this, then of course the stress may not be perceived as bad. But when you don't have the resources, when you're a mother and you can't provide food for your children, or you don't have support systems to help you, then that's when sometimes the stress has a greater impact upon your physical and mental health.
Right.
I wanted to talk a little bit about when you spoke about caregiver stress. I'm thinking about the care coordination of caring for children with special needs, also caring for, as Fay Jacobs mentioned, the sandwich and club sandwich generation or situation. Without proper care coordination, we're down to our very nubs of our fingertips because we are just without additional ways to handle those types of responsibilities. So there are certain ways, and I always go back to technology, there are certain ways to provide care coordination using other resources that could be very helpful for families dealing with these types of situations. So Dr. Jarrett, I wonder, with care coordination, do you ever use technological resources to help your patients to handle care coordination? I know
we haven't had the opportunity to use as many technological resources. I know that a lot of the nutritionists and some of the therapists that I have been referring to have been doing telehealth with patients. I have also been doing telehealth, but I would not say that we're using that for care coordination per se.
Okay.
Yeah. So the next question is, how has COVID impacted women of color mentally?
I would say I'll jump in and say it's impacted us tremendously because as Fay was mentioning earlier, sometimes you need to just take a break, take a walk. But when you're responsible for small children and getting their education together, your daily habit has completely turned upside down. In some cases, you're working from home as well. Maybe someone in your family has lost their job due to COVID. There are financial stressors, as Dr. Canty Mitchell mentioned, and of course, with all the social unrest that's going on, and of course, all the political, that's a lot to handle. So if we aren't able to get ourselves together in terms of finding resources that are helpful for us, it's very difficult to maintain. And actually, again, Dr. Canty Mitchell mentioned the impact on the body physiologically with different stressors. So with COVID, the pandemic, I think, has just been, in some cases, disastrous for some families.
I was just thinking about the racial reckoning that we're having going on. And Dr. Canty Mitchell, I just thought about you and if you're seeing anything with adolescent stress due to that. Have you noticed anything going on with that?
Well, I've done a lot of research, not specifically related to COVID, but a lot of the research has been related to adolescent stressors and what are some factors that may kind of mediate those stressors. And two of the major ones that I found through the research was social support. And that could be, the family is really the immediate source of support for young people. They found that that's the critical. And then followed by teachers, and then last by friends.
Right.
So right. I think those adults in the adolescent's life has an important role to play in helping to reduce stresses. And the other component that I found out was their hopefulness, their ability to have hope for the future. And those kids that have all those stresses with little hope tend to have more behavioral problems than those who had some. So a combination of support, hope, I guess, into that spiritual dimension as well is what I think it could be. To have goal setting is something that they can feel like they've accomplished in their lives. So I I know we've had an increase in violence during this time, increase in alcohol use, increasing all these other factors during this pandemic. So I think that's a general for not only adolescents, but for others as well.
I think also to piggyback on what Dr. Mitchell said, especially with the millennials who have been living in an instant gratification period in their lives. And all of a sudden, this COVID-19 has hit, and it is not easily solvable. Okay, and they've lost control of not only the millenniums, but people in general. We have gotten to the point where we're isolated. We can't go here. You can't do this. And we as a society here in America, we're not really used to somebody saying, no, you can't do this. Generally, we can maneuver around. But this COVID-19 had made it so I have no control of this. And so when you don't have control of a situation, if you are not mentally healthy, anxiety will come in. You know, if you don't know how to strategize to say, okay, let's take this not only as not as a defeat, but as an opportunity to do something else. I think that what we have done is focus so much on what I can't do as opposed to what I can do. Something as simple as with older adults, learning how to use the Zoom. Believe me, 2 years ago, I would not have known how to go on Facebook nor to use Zoom. But think what we have done, how to do this. So I think this COVID-19 has had its challenges, but it also has had some good points in some areas. But with the millennium generation, I think we need to, this has been a way to let them know everything is not easily solvable. And it's going to take some time to do it. That's an adjustment. They live in a generation where you can prepare a meal in 15 minutes, just pop it in a microwave oven, you know, or if they are looking at television, all problems are solved in an hour. If it's a mini series, it may be 4 hours, but however, real life is not like that. And then the pressure of, especially with women, I'm supposed to look good. I got a certain type that I'm supposed to be at all times. I have this makeup on. I can do this. I can do that. And in reality, you're setting yourself up for an impossible goal. Know your limits. And as I said before, it's okay to say, I cannot do this. I just can't. It doesn't make you a lesser person. It doesn't make you weak. As a matter of fact, I think it makes you stronger if you realize and you can honestly say, I can't do this. And you know what? I don't want to. It's okay. You know, I think you give yourself a pat on the back to be strong enough to say, somebody else has to do this. Because if not, high blood pressure, asthma, either your autoimmune system is affected. A common cold will knock you out. I mean, this is the way of the body saying, okay, if you won't take the time to take care of yourself, I'm going to fix it where you're going to have to. And then what you realize when you are disabled, when you are ill, somehow other people come about, and those people who could not do something, who, couldn't help you out, all of a sudden they found the time to do it. It's okay. You have to set your boundaries and say, I can't do this. It doesn't make you a mean person. Doesn't make you selfish. I keep saying that. It makes you stronger because you know your limits.
So, Ms. Jacobs, let me also ask you, what did you see in terms of dementia during COVID and the particular challenges in dementia during COVID?
I think it was harder on the caregiver simply because you are you're coping with what you don't know, and you're trying to give emotional support to a person that may be disoriented, may have communication skills. What dementia clients really need is a routine. They need that, and this COVID-19 has stopped that routine. They may be used to you going off to work, and all of a sudden you're there all the time. They may be used to having something as simple as lunchtime is at 12:30. I live with a son that's disabled. And so his routine, no matter what, if it's just a hamburger, is knife, fork, spoon, glass, and his food. Okay. Well, if I am working from home, sometimes I don't have time, even though I know his routine and I know what his behavior is going to be. If I don't have that knife, fork, or spoon for a hamburger, it's going to be conflict going on. And so once again, that's a stressor. Sometimes you don't have time to do that routine. But if you want to have, as I say, moments of joy, you will strategize. How can I do this? How, because that's what you want. You want to have moments of joy when you're working with clients who are living with dementia.
Well, how do I relieve myself from guilt when I take time for me if I'm caring for someone, elderly or otherwise? Either Dr. Canty Mitchell or Dr. Cooper, if you all have anything to add.
Dr. Cooper, that sounds like one for you.
Well, it's so interesting that this topic came up because we have, as a classroom teacher for 25 years, there are certain structures that the children need. We walk in and we have a greeting and so forth, as you probably remember from your school days. If any of those are upset, there's a fire drill, tornado drill, for some reason the kitchen doesn't have hot lunch that day. If it snows, the whole system is just completely on its ear. So with COVID, you could imagine all of the changes that are taking place and all the ways different people have to understand, I can't do what I did before. I don't have the same freedoms that I had before. And I think that is what's causing a lot of the unusual behaviors that we're seeing. Just as an aside, I'm thinking about a lot of the articles that you've probably noticed of unrest on flights, on airline flights. When we take a plane, and I travel quite a bit, there are certain structures, there's certain procedures and processes. You walk in, the flight attendants greet you, they assess you for, are you going to be someone who's going to be helpful? There's a certain list of assessments that they actually go through. But now with COVID and enforcing wearing a mask and the social distancing and all that goes with it, we've seen a huge increase in the number of disagreements and actual assaults that have taken place on flights. So COVID-19 has had a huge impact on behaviors, from the most simple as taking an airline flight to having lunch at a restaurant. Mm-hmm. So I think those are causing quite a bit of stress, as well as causing us to think, okay, if we normally did, as Fay mentioned, knife, fork, spoon, plate, hamburger, glass, and now we see that going to a restaurant, there's only one menu per table. And then there's a little card in the middle of the table for a touchless menu, where you have to scan that little QR code to get the menu. Now, I'm technologically savvy. I feel myself to be. But when I go to a restaurant, I want to be waited on. I'm paying you money. Whatever you're cooking, I could cook at home. But I'm paying you money for this food. I don't want to have all this stuff happen. Tell me what's on the menu. And and just as Fay mentioned, a lot of it is, I don't want to do it. It's not that I can't do it, but this is what I'm used to. This is a process I'm used to. And Dr. Canty Mitchell, maybe you could kind of clarify for me as well as the audience, what does that do when we are stressed because of small little details that seem to add up, and they just seem to just rock our world out of control.
Well, I think that goes into the strategies. I think that was one of the questions that we were presented with before. And I always, and at first, I have this down, we start with a self-analysis.
Mm-hmm.
Because you have all these things coming after you, correct? You have to sometimes say, wait a minute, what is it that's causing this feeling, this stress that I'm feeling? The self-analysis. You look down and say, okay, I'm at work. So what particular at work is causing me to feel stress? Because it's not work generally. It may be like one person at work. And then, what is it about family that's causing me stress? Is it financial? Is it my children? And if it's your children, what is it about that child, one child, that's causing you stress? If it's something related to other things, I think identifying what it is, not specific. Oh, work is just terrible. Oh, I can't. Well, what is it about work? Because only then can you help to find the resources to help you with that. And we sometimes don't take time to do that.
Yeah.
And I think name the thing that's causing you stress.
Mm-hmm.
Because caring for kids for some is like easy. I mean, I can just, I just love it. I get those serotonins going and I love it. But I have resources. I have a maid maybe coming in, which probably a lot of Black women do not. But I have my family. I have my mother, my sisters. They're all there to help me. And so identifying it, naming it, writing it down. I do believe in writing down what is the stress. And then, what is the most things causing you the stress? What is the most things that's causing? And deal with that one first. And then I always tell, we did some self-care. I'm a co-chair of the Physical and Mental Health Program at Delta Sigma Theta Sorority Incorporated, our Wilmington chapter. And I did a presentation on self-care. And one of the things you have to do is name it. And then only by naming it can you say, what can now I do for this one particular thing to help me? And it varies depending upon the situation. But the self-care is most important. And I think that gets into the guilt question that was asked before as well. And that is, when you identify the stress, what's causing it, what resources you have to deal with it, I think the guilt helps to melt because you have to take care of yourself.
Yeah. Again, to piggyback off of what Dr. Mitchell was saying, I had a friend who called me, and it was about 7:45 in the morning, who had convinced herself that, okay, I think it really is time for me to take this dementia test. And I had said, what's wrong? And she was at a stop sign. And she said, for a few minutes, I did not know where I was. And I went, what? She said, no, I literally, I was at the stop sign. I didn't know where I was. And the only thing that brought me back into reality, she said, was the car behind me. He honked his horn, and that got me back. So I said, well, for one, what are you doing up at 7:45? She is retired, and was happily retired. And she generally did not get up before 10:30 in the morning. Well, I said, well, tell me what has happened. Her daughter had moved in. The daughter had been away, is going through a divorce, and brought the two children home back to mama. And so mama, in order to help the daughter, was taking the little darlings to school. So I laughed and I said her name. And I said, first of all, this, as you said, name the source. I said, first of all, your daughter has moved back on. Let's face it, you really didn't like her as a teenager. And now she has come back home. You're used to getting up whenever you want to. Well, now you have these two little darlings who you love. You really do. But they are in your house all the time. You don't have a break. You're now getting up a whole lot earlier than you did to take them to school. You've got traffic from one end of the town to the other end. taken them off, and now you're at a stop sign. Now, if this continues a lot, run to a doctor very quickly. But you have so much stress on you that you have, again, had no control of anymore. You open up your door and there she was. So those are lots of things. Don't self-analyze yourself. It's a good thing you recognize something was going on. Do go to the doctor. But as Dr. Canty, as Dr. Mitchell said, define it. And I was helping her through that. So thank you for saying that, because that's what we have to do.
That was wonderful.
Thank you.
We have an audience question here that I often see too in caring for the elderly. And if I do not have a family member to allow me to take respite, are there resources in the community that can help?
Yes, we are trying to get to that point. At one point, I did know the Elder House had it. They no longer do. There are some agencies. I would contact Cape Fear Council of Government. I would contact your senior center. There's a good resource of what you can do. And they could help you better with that. As I said, there is a need for respite care, but I would start out with those two places and they could direct you.
There are some hospice and palliative care organizations that also help with respite care in the area, but they have to be enrolled in that beforehand.
Mm-hmm.
I think there, at least here in the Midwest, and I would imagine so in your part of the country as well, some area churches offer volunteers. Other areas where there are volunteers to help out, as you mentioned, hospice would be a great resource as well. So I think there are some that you can contact through different resources that might be available through technology. I always go back to that. We can sometimes Google different resources that might be available that you might not be aware of. Of course, you need to make sure that you vet those resources and make sure that they're credible, they're bonded, and that when you leave your house, you have when you come home to your house, you have the same possessions that you had when you left your house, so that someone doesn't relieve you of your possessions as they're also watching your family members.
Now, some of the hospice organizations do have places that you can physically take your family member to stay if you're leaving for the weekend. So it's not always that somebody's coming into your home. So that might make some people feel better. And I also just want to speak to the fact that a lot of people kind of freak out about hospice when it is really a great thing to do for your family member. And they've changed some of the names. Sometimes they call it palliative care, because really they're just diseases that we're not going to reverse, but it doesn't necessarily mean that you're going to, die in 6 months or anything like that. But they're just like dementia is just something that we can't reverse. And those patients do have to be taken care of. So now they offer palliative care for those type of situations. Okay. How does life expectancy affect the sandwich generation? Ms. Jacobs, you spoke a lot about the sandwich generation. So how does life expectancy affect that?
It has a tremendous effect on the caregiver. In most research, I've found that, unfortunately, and I don't want to be doom and gloom. Most of the time, caregivers don't outlive the people that they are giving care to. And it's because of the stressors that you have as a caregiver. I think that, again, you will find that most caregivers will have some health issue going on, mental health as well as physical health. And again, it goes back to you have to learn self-care. And it goes back to don't be ashamed of it. I was listening to what Dr. Mitchell was saying, Canty Mitchell was saying. We have gotten so in our community, the community of color, touchy feeling things. We are so driven in the bare facts of life that having to deal with emotional issues, we kind of share, we don't put a lot of stock in it. But research has found that if we did, we would live longer. If you take that walk, if you take that time to do some meditation, if you just stand still sometime, just take that breath, to say, okay. And again, take the guilt away. And it is hard, as I said before, this deathbed wish promise that you gave to mom or dad that you would do it. At the time you meant it, and you still want to do it, but you have to recognize that you can no longer physically nor mentally take care of this person. You are endangering yourself as well as the person that you are taking care of. And oftentimes this is what occurs. Your life expectancy is in danger, is at risk, unless you learn, again, self-care.
And I remember so vividly, my next door neighbor, he was a male, but he had retired from New York to Florida, where I was living at the time. And, he was taking care of his mother, his wife, who had dementia. And then his two sons came to live with him. Both are adults, and they both have their own jobs, but they both were dependent on him. He died in the driveway, walking from his house. And I said, afterwards, then the kids stepped in, they sold the house, they had the mother in a smaller place, and they managed. They survived. But, he was dead, he was gone. And so, we don't want to put that much stress on ourselves as caregivers, whether we're caring for children or caring for our aged parents or caring for anyone, that we don't engage in our own self-care and have that happen to us.
What strategies? I'm just thinking about some people that I see, and it seems often there's just one child in the family, one child who steps up and does everything, and the rest of the children are fine to allow that to happen. So what strategies can you offer, or ideas to pull those other children in, or pull those other family members in to help? Like you said, the son stepped up and they were able to do more than they were willing to at that point. But
I'd like to step in and just give another perspective of that. When there's one person that steps up and takes charge, everyone, I guess often people assume that all the ones in the background don't want to participate. Sometimes that one person wants to be that one person and discourages others from stepping forward. And so I just think there are two different ways to look at that story. But one of the resources for that one person who is stepping forward is to, of course, as Dr. Canty Mitchell mentioned, self-care. And some of the forms of self-care include having a therapist that they can see face-to-face or virtually, which is how I see my therapist, virtually. But so many other ways: journaling, resources within the neighborhood, and other types of resources that are state funded. But when there's one person caring for that either a sick person or a person who needs extra care, there are several different ways to get other family members involved. And one of those ways might be to kind of step back a little bit and let others do what they do best, which may not be what that one person thinks needs to happen, but we all have our skills and talents, and should be able to use those skills and talents in the way that helps the person in need.
For example, older sisters or younger sisters sometimes, are the persons who end up taking care of the parent. And it's not that the others do not help and support. It's that sometimes they want to know, what can I do to help? So just say you're not helping does not help. It may be that I'm going to take moms or dads for 2 weeks like I did around Christmas a few years, and before she died. And so that gave the others a little time for respite to go have vacation and Christmas with their children. So I think it's not that the people do not want to help, but they may need to know, what can I do to help?
Okay, well,
So
that's a good idea, I guess,
Yeah.
to be, like you said, be specific in your ask
Yeah,
or
exactly.
what you're asking for.
Exactly.
Okay, that's a good idea.
Form a care team. Like if it's 2 or 3 siblings, somebody may enjoy doing laundry, and so they may do the laundry. Or some people may like just going to the grocery store. They may, do the grocery shopping, but be very specific with what the patient wants and not what you think they want, because
Right.
that will have conflict. But assign things, and maybe you can get them to do that. This is a family, but it takes some counseling to do that, because there are some families, and we see this, who really don't want to do it. They can't deal with mom or dad because they see them the way they want to see them, and they can't deal with them, this frail person or this person who does not recognize them anymore. Emotionally, our sibling they just can't handle it. And so it's much easier to say, oh, you handle this, because I just can't do it. And especially if it's the youngest child, they were the baby. and you're the oldest, and you can handle this, and you convince yourself again that I can handle it. So you have to learn to say, no, this is what is going to happen. And you have to learn to do it. I go back to, it's not being selfish, but it's for everybody's well-being. Self-care is important, and that's a part of self-care, knowing my limits.
I don't want to either underestimate the importance of humor, and also finding things to give you pleasure as a caregiver. What can that be? I mean, it could be something simple, but then, the person has to determine what that might be. For me, it could be just getting a massage or get my nails done or something like that. It could be something simple, or just taking time to go shopping by myself and have somebody else be there. It could be music, dancing in the house or whatever, to give you that break from stress. So, but everybody has to determine that for themselves. What is it that gives them pleasure?
Right.
Because you want those dopamines, the serotonin and dopamines to kick in for the pleasure component. But then you don't want the cortisol to take over. It's cause all kind of other problems.
So we are almost out of time, and normally I give everyone the opportunity to have a last minute word. So we'll start with Dr. Cooper. What would you like to leave the community with?
I'd like to leave them with the opportunity to use telehealth, to use behavioral health in whatever way works for them in providing self-care, to giving them a relief of their stress, and also to look at different ways that you can be kind to yourself that doesn't cost any money, but also, as Dr. Canty Mitchell, releases those dopamines, gets those dopamines working. That's what we want. So that's what I'd like to leave with. Thank you for the opportunity.
Thank you. Dr. Canty Mitchell, what would you like to leave?
I would like to leave them with, everybody has some stresses they deal with, some more than others. And then it's a matter of not what stresses you have as much as how you deal with it and what resources you can find to help you. And so don't get too overwhelmed and get into those negative behaviors, too much smoking, too much drinking, too much sex, too much whatever, too much food. But to look at other ways and avenues in which you can find pleasure to take care of yourself and have some fun in life.
All right. And Ms. Jacobs, what would you like to leave us with?
know your moments of joy. You will find them. Look at that person that you're giving care. Go with them where they are, not where you want them to be or not where they have been. Look at them as a person. They are still there. And you can still have moments of joy with them.
Well, thank you. I have really enjoyed talking to you all today. I have learned things that I can use in my practice, and I hope that the people who have been on listening have learned strategies that they can use to deal with stress, and that we can relieve ourselves from trying to be superwomen. Thank you all very much.
Thank
Thank
you.
you.
Enjoy
Thank
your
you.
weekend.
Good day.